It is after-school playtime in this Nigerian orphanage, time for everybody to have fun. The background of the children here is one of tragic diversity. Some lost their parents to AIDS, others were abandoned, others removed from their families because of abuse or a parent's mental illness. However, there is a bright note as well. In the past, a lot of babies were brought here because their mothers died giving birth, but that is changing.
10 years ago, we have at least one in a month. That's equal to about 12 in a year. But for the past 2-3 years, the number report incidents that are brought here has been reducing. This year alone, we've not received one.
Nigeria's primary healthcare system is going through a transition. The country has the highest number of maternal deaths in the world. 1 in 8 children dies before their 5th birthday. 2 out of 5 children under 5 suffer from chronic malnutrition. Health services are unavailable and unaffordable for millions of women and children. But recently, the country started to change this by introducing a free basic health plan for all its citizens. The goal: bring quality health and nutrition services to underserved communities that need it most. But easier said than done. Clinics had been underfunded, staff was unmotivated, and services expensive. It meant dealing with a system that had failed in bringing down high fertility rates. And insurgencies in the northeast of the country had left many communities fragile and without any health services at all. These challenges had outpaced government spending on health and nutrition, and the poor were getting poorer because they had to pay out of pocket themselves. In 2014, Nigeria had declared health a priority in its National Health Act, but only now the necessary funds are available. The Nigerian Federal Ministry of Health has started to tackle maternal, newborn and child health, together with the global financing facility, short GFF, which brings international partners together to design comprehensive solutions. Together they have addressed the nutrition crisis that has stunted millions of children, starting its initiative in a number of pilot states and eventually expanding it to the rest of the country.
One thing that fascinates me about GFF is the ability of GFF to also drive domestic resource mobilization. It creates a new sense of awareness that you must put your own money on the table. It's a catalyst for encouraging governments to say, look, own this initiative, put your money there.
And also make the best out of it. Performance-based financing of clinics has turned out to be key to improve services quickly. In the past, many of these women did not come to the health center as services were unreliable or essential drugs not available. Just listen how it is starting to work now.
Before, our immunization day was Tuesdays and Thursdays, but now they said we should make it on daily basis. Please be free in any language. I believe some of the health workers understand some of the languages. You can speak in Igbo, Yoruba, Hausa.
Clinics now are service-oriented, the staff highly motivated, immunization, nutrition advice, everything is available at no charge.
Like HIV test is free, and giving of the net is also free, and some other things.
Even cooking classes are being offered to tackle malnutrition and teach mothers about essential food ingredients. Because if the clinic performs well, the clinic is being paid well through the program and staff receives bonuses. Performance is strictly measured.
They'll assess how many antibiotics you use in those patients, in 100 patients. If it is more than 30% of 100, it's no good. You fail that one. But it should be less than, because they are discouraging people or the staff from indiscriminate use of antibiotics, because this goes a long way to create resistance in patients.
The broad effort to improve the collection of data includes proper birth registration to have a more solid data foundation for improvement in planning of services. Part of the remarkable progress in improving maternal health is due to improved family planning efforts. This information session is a huge success with rural women. Adolescents who grow up in a conservative culture are particularly welcome here.
Statistics and evidence have shown that one of the common causes of 5 common causes of death amongst adolescents, especially pregnant women, is issues related to abortion. So family planning is an important and key area.
And with many women opting for a free-of-charge birth control implant that can last up to 4 years, the added benefits are obvious.
Me, I do it because I went back to school. It's good because I'm free now. Anytime if my husband requests me, I will do that because no, you will not even think about that. Yes, if I do that, I will get pregnant.
The different Nigerian states also contract and train community health workers who can advise about nutrition, malaria or family planning. They are venturing out to households to bring all the benefits of free healthcare and nutrition to everybody in what is Africa's largest population. And it comes with an extra dividend for a country that has seen the rise of terrorism.
Lack of access to basic essentials, education and health. And to me, this fueled insurgency. Insurgency would thrive in a climate of underdevelopment and poverty. People feeling neglected, out of the scheme of things. And so we're not just using that money, we're also creating an atmosphere of inclusiveness, giving them a sense of belonging, that this country belongs to all of us.
After years of declining services and frustrated patients, Nigeria is starting to succeed with free healthcare for everybody. The cooperation of public and private sector has been key in this achievement.
I really think it's the change of mindset of government, that the public sector has recognized the critical role that the private sector has to play and has engaged the private sector and vice versa. Now we have open communication, open dialogue. We're able to speak with the government more openly about critical issues that affect healthcare as a whole. The private sector brings with it efficiency, effectiveness, the ability to leverage on innovation and an outlook on quality. And together we can sit down and devise plans that can help to change the narrative for healthcare in Nigeria.
Nigeria finally has laid the groundwork for Nigerians to be healthy and productive throughout their lives. The health sector in Africa's largest economy has started to talk the talk and walk the walk.